Abdominal surgeries done with huge incisions and long recovery time are now being done through the belly button.
Yeah, it's amazing. ABC4's Barb Smith joins us live from Utah Valley Regional Medical Center with this new technique for your family.
Robert and Kylie, this technique was only developed about a year and a half ago, so it is relatively new and certainly new to the state of Utah. But with an incision about this big, doctors are able to perform surgeries by going under the belly button, and they can get to things like your gallbladder and also even perform hysterectomies.
I'm ready to get on with my life.
Jackie Mahoney is having a hysterectomy.
I've just had a lot of problems up to this point.
She put off the surgery because of the 6 to 8 weeks of downtime for recovery, but changed her mind when she learned about single incision laparoscopy.
I work full time, and when I heard 2 weeks off of work instead of 6 or 8 weeks, I was all for it.
Dr. Justin Lee is currently the only surgeon in the state doing the belly button surgery for hysterectomies. He's specially trained to use the newly developed technique and says the recovery time is just one benefit.
Single incision laparoscopic hysterectomy is a viable option, and it's also less trauma to the abdomen.
A 2 to 3 centimeter incision is made under the belly button, where surgeons put in a single medical port.
That single port that will allow different instruments that go inside the abdomen allow us to deflate the abdomen with gas and look at the uterus.
Dr. Lee says because there are very few nerves and blood vessels in the umbilical area, there is also less pain. And because the whole surgery takes place under the belly button, there's no visible scar.
Oftentimes it is pretty much non-visible.
Jackie says the procedure was worth the wait.
I think it's amazing.
And it is amazing that this is happening. There's only 20 surgeons locally in the state of Utah who are qualified to perform this particular technique of surgery. They use it for other medical purposes other than hysterectomies. And Dr. Lee said it's pretty important to find one who is well trained, because the downside, the major risk for this surgery, is developing a hernia later on if that incision is not properly closed. Reporting live from Utah Valley Regional Medical Center, Barb Smith, ABC4 News.